think you just turned the recording. Oh, there it is. Sorry, my bad,
Should be.
Michaela.
No, you're good, Mari. I appreciate that assistance. It's hard to kind of watch the technology and make sure it's all where it needs to be, but thank you. All right, so we are ready to begin today's webinar. Thank you guys so much for joining us. We are excited to get to host this second webinar in the collaboration that we have with the Department of State Health Human Services. By offering these trainings to you guys as professionals and as families working with and raising children who are deaf, hard of hearing. We have Dr. Sarah Wainscott joining us today. Unfortunately, Dr. Karen Diddy had a family emergency and is unable to be with us today, but Dr. Wainscott is going to do the webinar, and she's prepared and ready to share Karen's input with everyone. And so we are excited to have you join us for our webinar titled, How Can We Help Our TEHDI, T-E-H-D-I, Families to Follow Through? We want to go ahead and turn this over to Dr. Wainscott and let her get things started.
So hi there, I'm Sarah, and in addition to being an audiologist, I am also a mom of a couple of deaf kids that aren't really kids anymore. And when we started this project, we said, hey, there's 3 topics that we want to hit based on the feedback that we've gotten from professionals over time. And those 3 were how to navigate those complex systems, how can we help families to follow through, and then what about best practices? And so this is the how do we help families follow through? Because, hello, nobody wants to blame the family, but we also say, sometimes they don't follow through, sometimes they're the weak link. And so is that true? Is that not true? We really want to help them follow through. And so our topic today is advocacy, because that's the answer. Want to note that we are Texas Hands and Voices, and that this is funded by the Department of State Health Services. And so we appreciate their support in this collaboration.
Sarah, 1 second, if I may interrupt, just would you, we're seeing the slideshow on our end with 2 slides next to each other.
Oh, I'm
Would
so
you be able to put that in presentation mode?
Yeah. No?
Still the same. It's showing the current slide and the next slide.
The next one. Is that better?
There we go. Perfect.
I'm so sorry. I didn't have my settings.
Thank you.
Thank you. And so advocacy, is that really your job? Well, we would say yes, it's for every type of service provider. And so we want to walk through 3 different types of advocacy, because sometimes maybe you're doing advocacy and you didn't realize it, or sometimes there's additional opportunities that we really want to point you to. We also want to give you resources with TEHDI, our partners, to be change agents. We're going to define that in just a minute. And we talk a lot about what's not working. It's also important to stop and say, hey, this is what's working. And so we want to give some shout outs to many of you and what's been going well. And really at the end, to issue a challenge for you to engage in all of these types of advocacy. So we're going to start by opening up that chat box, and just really quick, how do you define advocacy? What is your definition of advocacy? Jump in the chat and let us know. I'm going to give you a couple minutes. All right, we got Selena and Crystal. Come on, a little bit more participation here. Give us a definition of advocacy. Okay, we've got some coming in. Education and support and guidance. empowering the person or families to speak on behalf of their needs, standing up for what's important to you and your family. Can we get a couple more? So here's a definition of advocacy. Any action that speaks in favor of, recommends, argues for a cause, supports or defends or pleads on behalf of others, right? And so those are all things that we're going to engage in. And oh my gosh, sometimes I feel like we do a lot of pleading and defending. And this is why, because you guys are change agents. You, in whatever role you play, are someone who promotes and enables change to happen within a group or within an organization by the initiative that you take, by acting as a catalyst, somebody who starts the things moving in the right direction. And so I think what I would encourage you to do, even as we begin this talk, is to put on your change agent hat, to recognize yourself within that role. And as we think about advocacy, we've got some guiding principles here at Texas Hands and Voices. We would say some principles of advocacy: open communication, that we've got non-judgmental communication, that we're listening, that we don't have an agenda that we're trying to push, right? We're letting that family guide that communication. We want to continue to provide information throughout the decision process, the action process, not just at the beginning, but all the way along that continuum. We want to take time to respectfully address any misunderstandings, any fears they have, right? And never to belittle those. We want to make sure we're showing them a range of options and that they're seeing lots of different paths of success for their family to choose from. And also to let the family change their mind if they want to, right? That you don't have to pick one direction or the other. And when you pick, it's okay for that decision to evolve based on what your family needs. To maintain communication, but also to operate on that family's readiness schedule, right? You're calling on them to make decisions. Their timeline may not be the same as yours. And I say that, we understand, man, we want to stay within that 136, absolutely. But understand that different families are going to process information on different timelines. Right? Our goal is to give them every support to help them move along, and then to be ready to engage other trusted individuals for support, and recognizing when, man, they've gotten to the end of your knowledge base and you really need to pass them off, or can you come alongside and collaborate to provide a different perspective. We're going to introduce you to some great resources today, and I want to note where they come from. These are great start resources. And you see this lovely little room, this little playroom. This is a website that's been put together by National Hands and Voices. And so we're going to keep coming back. In fact, we're going to walk through those 3 little balloons there. But I just want you to have a sense of where it comes from, right? And remember that we are going to send you the PowerPoint so you'll be able to just click on. We're going to walk through 3 different types of advocacy over this lunch hour. And we're going to start with system advocacy. And our objective is to build a better system. And when we talk about systems advocacy, we're thinking about efforts to change the policies or the practices, those things that guide how services are provided. And because we change the system, we recognize that that's going to benefit the most people. And so system advocacy is often the most time-consuming and laborious, right? But we also recognize, man, it makes changes for a lot of people. And that's frankly, primarily why we at Texas Hands and Voices are partnering with the Department of State Health Services. We want to change the system so that it works better for families. And some examples of that would be like legislative action or project development, changing leadership, changing policies, empowering your partners. And so we want to give some shout outs, just recognizing that increasingly any materials are in Spanish, right? Or in video format. And that simply helps everybody. It makes it more accessible for a broad number of families. We've looked carefully at that language, and Dishes has looked carefully at that language. And increasingly that language is parent friendly. We're working on getting that website easier to navigate from a parent perspective. But all of those things that improve the system improve things for lots of families, right? Making sure things are captioned, right? Those are other examples. Another shout out, we just wanted to shout out to Corpus Christi. We do regular seminars, and we did one most recently in April in Corpus Christi, and we're just impressed with the way that that region showed up. There was active networking, there was sharing of resources. You had providers from clinical placements like Driscoll alongside ECI. We had people drive up from the valley to collaborate. The RDSPD showed up in a big way. All of these individuals facilitating connections. And so, I mean, the best takeaway wasn't anything that we said within our summit, but these natural connections that happened that facilitated these long-term partnerships, right? Identification of difficulties and barriers, but also workarounds. And so that was a win. Anytime that you can get your people together is a win. When we think about advocating within our system, we would say, hey, look at the TEHDI website, right? That TEHDI MIS, EHDI PALS, you should be familiar with that by now, but this is a national database that can link you to audiology services. So I can filter by my zip code, by my region. I can identify providers that speak Spanish, that do sedated ABRs, that dispense hearing aids, whatever it is. And so if I'm trying to find audiology systems assistance for a family, that's the best way to go. I can even find information there, for example, about what insurance they take. ECI, early childhood intervention, absolutely. We want to know about that. You should be connecting with them. Those are resources within your system. And then that regional day school program for the deaf. And many of the people that we collaborate are less familiar with that regional day school. When we talk about 0 to 3, everybody knows ECI, not everybody knows about those regional day schools. And so if you go to this link and it's on the SOC website, you're able to plug in where you live, and they can tell you where the regional day school is within your area. So this is the first little pink balloon from that bundle that you saw. But I just wanted to make you aware of all of the resources that are here for families. And so if we link, and Michaela, can you see my screen still? Are you able to see that website?
We see the screen, but it did not link to the website.
Okay, here we go. What about now?
Yes, there we go. We see it now.
Okay. And so this is the knowledge balloon, right? And there's all kinds of information, and I'm just going to let you take a peek of it just to get a sense of how much information is there. And this is really a walkthrough that you could do or pass along to families, and you can learn everything from that Hands and Voices guidebook. You've got links to making a plan for your child, planning an IFSP, advocacy, all of those kinds of things. So when we're thinking about system advocacy and providing information and knowledge to families, this would be just a primary resource that we would like to highlight. I'm going to go back to our PowerPoint here. We'll talk about our next flavor of, first of all, I wanted to, we talked about system advocacy. Jump in the chat. What are some ways that you have seen system advocacy be effective? We noted that summit. We noted those Spanish materials. What are some other things that you've seen? Some ways that system advocacy has been effective?
This is Michaela. If you don't want to write it in the chat, feel free to pop on and verbally or let us know what you think. Yep.
It's increased our numbers of of early identification with the babies here in the Valley.
Well, increased numbers of identification is a win. I see doctors listening to nurses' suggestions, right? That's a win. That improves our system efficacy. Getting input from the community, right? And that community can be a local regional community, or it can be a representative community. More frequent meetings with this group, being able to share resources, sharing knowledge with other programs, right? Those are all examples, great examples of system advocacy. And yeah, kudos to you guys for being involved in that. Yeah, if you see more identification, that is absolutely a win. So we had 3 types of advocacy, right? We talked about system advocacy, right? You guys identified some of those. The next piece we're going to talk about is individual advocacy. That idea of I'm here to help, I'm here just at the right time. And so what does individual advocacy look like? This looks like helping an individual or a family solve a problem and find supports right when they need it to happen. And so this isn't as formal as something like let's improve systems and services, but it does make a significant difference for a family at a crucial time. And so who does this? Well, caseworkers, audiologists, our parent guides, those FSAs, all of those individuals. When you engage with a family, when you help one family at one time, that's individual advocacy. Frankly, sometimes it's overtime, right? Multiple engagements. And so I'm thinking of a family in the Rio Grande Valley. They had a child that was just diagnosed, but the child had microtia. If you're not familiar, it's a condition in which that ear looks really tiny. And often it's accompanied with atresia, which means that ear canal is blocked, that sound doesn't get through. And so those families, not only do they have a hearing loss, but their kid looks different and they're challenged. And I don't see any other families that have this. And what am I going to do? We got on a call, and even though the individuals within that community were not familiar with how to support microtia, we were able to connect them with something called the Ear Community. And it's an online resource for families that all have microtia and atresia. They were able to connect with other families like theirs, including families that were like theirs that speak Spanish. They were able to identify lots of resources and support, but they were also able to get some of those emotional needs met in terms of what am I going to do? How is this going to work in terms of communication? But also, how are we going to navigate explaining this to other people? We were able to give them, again, education, cultural connections, options, and then push those resources back into that local space. But all of that happened because those those connections were already there within the community, but also on that state level. And we often hear stories and get ready to put in the chat box because those social workers are heroes. And we love to hear stories about how those social workers really helped families get to that next step exactly when they needed it. And that's critical. What are some resources to facilitate that individual advocacy, to get that family to the next step? Well, certainly we would say that statewide outreach center, and they have a whole section of services just for 0 to 3. So that's a go-to. Just in time, NCHAM, that National Center for Hearing Assessment and Management. This is a PDF. But it has, hey, these are lots of things, parent resources that parents typically ask for. And it's a huge, long PDF with lots of links. And you can even, there's a place within that just-in-time site to copy a badge so that it can go in your email. So every time you email somebody, there's a link and they could click on those just-in-time resources and find them. I also appreciate that they have resources from a variety of perspectives, right? And so regardless of which direction that family is going in terms of communication, they have things in terms of technology, they have things in terms of what about the identification process, just lots of links for families. Infanthearing.org. This is one of our favorites because it really provides resources for families in the how-tos. How do I facilitate sign language? How do I facilitate listening and speech? But from a really parent-friendly and a broad perspective. Babyhearing.org is a parenting resources. And then that supporting success for kids with hearing loss. This really takes those families to that next level and really looking at school resources and readiness. So those would all be things that we would tout. I'm going back to that, those resources from Texas or from our National Hands and Voices group. And these are resources related to empowerment for families. Right. And again, that green balloon, you have lots of different information, and this would be really a walkthrough, almost a course on parenting. What about decision making? What about parenting, things like safety and positive interactions and responsive parenting? How's our family going to adapt? How are we going to problem solve? There's lots of activities, lots of resources in Spanish as well as English. Just again, a plethora of resources for you there. All right, so now it's your turn. Pop in that chat box. What are some ways that you've seen effective advocacy for individuals, individual children or individual families? Hop in and give us some examples, or like Michaela said, you're welcome to shout out. Oh, I missed this one the last time, but I really appreciate this from Crystal. The more we talk about things as a community, the more they don't end up on the back burner, right? I love that because we've all had experiences where we come together, we talk about things, yes, 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 and then we forget about it. So I appreciate that feedback. But I don't see any examples of individual advocacy. Can you give us some examples? What about you social workers? I know that you reach out and help those families. Can a couple of you give us a quick sentence story?
Sarah, you've got some insight there in the chat. Selena said gathering information to be well informed. Jackie said when families speak up during ARD meetings, know their rights and are empowered during these meetings. Melinda says through role play and modeling.
Yeah, perfect. And that modeling often comes from that parent-to-parent support. Listening to a family's needs to customize the help for each individual family. Yeah, and I just appreciate that that's time intensive. But if you're going to individualize those services, you really have to listen to what they need. During sessions, I love when families ask me questions after doing their own research, right? And so you've given them the resources and you've equipped them to build advocacy. And so that's really our next section, right? So that's a great way to lead in. And that next section is self-advocacy. So again, system advocacy, individual advocacy, and then coaching self-advocacy. I can show you how to do this for yourself. Right? And what we know is that long-term, that's the most effective. You're helping that family build skills and articulating their needs, and we saw that in the chat box too, to make informed decisions, to navigate their support. You know, that's again, time investment, but that's optimal outcomes. And we often see this through those intensive relationships, like parent-to-parent support, or so many of our families tell us about the relationships they had with that ECI provider or their teachers. Somebody that they're in an ongoing relationship who's able to come alongside and coach self-advocacy. We also see this in other providers, and I'm thinking of those family support advocates at the Texas School for the Deaf, as they call those families and say, okay, you know, how do I help you get to the next step? This is what you could say to the provider. This is what you need to ask. Let me help you understand what that test means, right? All of that online coaching, online, on the phone coaching, this is what you say, this is what you do, this is how to expect, go. All of that is providing opportunities for self-advocacy, for helping that family move. And then, Texas Hands and Voices, our Guide by Your Side program, that's exactly what they do. They come alongside a family. These are trained parent guides, and provide that ongoing coaching and support in terms of, this is what life is like. Let me help you make decisions. Let me help you identify resources. Let me be the person that you want to talk to about how this is difficult when other people around you don't have that shared experience, right? So those things are critical. Some resources for coaching advocacy. Again, Texas Hands and Voices, those parent guides, but also those deaf and hard of hearing guides, the parent training and resources that they provide. Just like we provide training for providers, our wheelhouse is really providing training for parents. That's who we are, that's what we do. Texas Parent to Parent has some additional resources and support for children with disabilities, and that's a broader organization, as well as Navigate Life Texas. There's lots of state resources and whether it's funding or agency support, those kinds of things. Navigate Life Texas would be the go-to there. Partners Resource Network similarly. Our National Hands and Voices organization, the balloons that we're going through today are from that National Hands and Voices organization. There's also the Family Leadership and Language Learning Center. We call it FL3 for obvious reasons. But this is funded by HRSA, the Health Resources and Services Administration, through the CDC, the Centers for Disease Control. And it houses just a treasure trove of resources related to language development, everything from resources and research to tips and tools. So this is our last balloon, and it talks about well-being, and what I also wanted to highlight within that area is, let me see if I can screen share this. Well, it's not letting me screen share this time. I'm not sure what my trouble is. But there's a parent's guide to deaf and hard of hearing early intervention recommendations. And it's really, like a step-by-step, more like a book, right? That's from National Hands and Voices. But parents really want to figure out how to navigate all of these services and recommendations. And that guidebook it's a great resource. Right. So coaching self-advocacy, this is a trickier one. Do you have any examples of yourself or somebody else coaching self-advocacy for families? Yeah, and I'm not sure where you put this one in, Mari, in terms of when it popped in, but parents insisting, that the doctors listen to their concerns and hear them instead of brushing them off, right? Coaching tenacity, and your right to be heard. That's a critical piece of self-advocacy. Any other examples of coaching self-advocacy? Where's our Any Baby Can friend? You guys do that often. Do you have any examples of coaching that self-advocacy?
Yeah, I'm sitting here definitely thinking and mulling that over. And I think that when we're in the homes with the families and say, if they're feeling a little nervous initially, navigating systems and making those phone calls and communicating with those different specialist providers or getting access to those types of things, I think that we really see them over time start to improve their confidence and just start to feel really confident. And then they take over that, and we're there cheering them on, but really seeing them feel confident. And that's obviously one of our biggest goals in ECI when they turn 3, is helping them to feel empowered and to feel confident in navigating those systems when we're no longer there coaching them along.
Yeah, I like that really moving from providing help to building skills, right? And that is a transition, but it really requires that relationship. I also see, hey, our ECI team managers, our team and case managers do this regularly with families, but also supporting each other. And I appreciate that you don't just coach the families, you come alongside and coach each other. Alejandra says, hearing out the families and coming up with a game plan together so they don't feel alone. I love that idea. So it's not just, hey, go and do, but let's make a plan together. And then let me provide the support so that you can carry it out. And then providing family choices and allowing them to pick what's best for their family and the tools that they need to start the process, right? So I appreciate all of those responses. We would also say that building leaders is a part of advocacy too. And so a primary priority of Texas Hands and Voices is to really build leaders that are parents themselves. And we've got 3 great examples here in our photo, but parents of children who are deaf and hard of hearing. They represent diverse experiences, and we believe that it's critical to have those leaders in the game as well. So just here's a quote to wind up. One person can make a difference and everyone should try. Okay. And I just want to open the floor at this point. Any questions that you have about resources that we shared or suggestions that you have in terms of, again, how do we get families to the next step? Any challenges that you have that you want to share?
Sarah, this is Michaela. Melinda put a comment in the chat that she feels it's important to lead the parents to become leaders themselves regarding their own children.
Yeah, that's a great perspective. You know, Melinda's somebody that's worked with us at Texas Hands and Voices and worked in other capacities over time. But that idea of leading parents, that it's not necessarily intuitive that I'm going to be a parent leader. And so part of it is to recognize the capacity in those families and to give them opportunities for growth.
We have another comment from Deanna. Research yourself so we are better informed for the families.
Yeah, and frankly, that's part of what we're trying to provide in this PowerPoint today. You know, we're not going to walk through every single link within your lunch hour, but just recognizing that those resources are there and where to find them. And Michaela will be sending this out to you as well.
We do have a little bit of a word cloud that we've generated based off of all of your feedback. So let me see, I'm going to share my screen here and you guys can see the little word cloud that's been generated based off of all the feedback that we got from you guys here. 1 second. Can you guys see that little word cloud there? I love how the biggest word is families. That from all of those things that we gathered from the input that you shared in that chat box, that family is loud and proud represented there. So that really acknowledges the work that you're doing, is that you're empowering families and you're putting them first. So I love that it's reflected in this graphic.
I think in Melinda's recent comment, as well as some of the others, just that idea that this is an ongoing process, that continuing to participate in things like webinars and these lunch meetings, having those connections, identifying resources, that it's an ongoing process and that it keeps these discussions at the forefront as we work to improve services for families. So thank you for your time today. And Michaela and I will be here for a few minutes if you have any
Yeah.
additional questions or resource needs.
Yeah, I do want to also encourage you guys, in order for us to continue with funding and to get insight from all of you about how you are utilizing our webinars, we have a short survey that we'd love for you guys to fill out. It helps us. And also share your feedback with our funding sources. I've put the link there in the chat box. If you wouldn't mind taking that quick
Please,
survey.
please,
Yes,
please.
we definitely appreciate that.
All
We
right.
are here for you if you need us, so please reach out at any time, but I'll let Dr. Wainscott wrap it up.
No, I was just going to remind you of the 3 kinds of advocacy to engage in all of them. That system level improvement, helping those individual families, but also coming alongside and coaching advocacy skills in the families that you're able to encounter. So thank you for your support.
Thank you, everyone. We'll be seeing you in August at our next webinar. And I'll send an email out with all of these resources as well. Alejandro did have a comment here. A lot of families that are always interested in the family events, but they're out of town. Any way we can move those events towards San Antonio. Alejandro, we are working very hard on moving some family events to San Antonio. One of our guides recently hosted an event in San Antonio at a park, which happened in May. So we've recognized that need and have started moving into the San Antonio area. So if you missed that one, we will keep you updated on events that are to come in the future. You can always check our website for events that we have coming up. And Alejandra, I see that you said you would love to help. So we are going to take you up on that, and I will connect with you and see what we can do to make that happen.
And then Crystal, shout out for the Rio Grande Valley as well.
Yes, thank you so much.
Are you familiar with the walk for hearing? I'm not walk.
The Deaf and Hard of Hearing Awareness Walk that's happening in the Valley, September 28th. 3rd annual. We're
Crystal,
excited
are you
about that.
familiar with that event?
Crystal says she is.
Okay, perfect. All right.
Thank you, everyone. Have a wonderful afternoon. We'll see you soon.